Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. I'm Michael Swartz, Certified Financial Planner and Certified Physician Development Coach, and today we have a very special guest, a coach that I met through the coaching network who is currently 62 years old. She retired from practice at age 59 and is an MD, a fellow of the American College of Cardiology and fellow of the American College of Physicians. And as I shared, retired at 59 from practice in cardiology at Baylor Scott and White Health. And now 3 years into her formal retirement, if we can even call it that. There's so much going on. And with that, I'd like to introduce Sarah Samaan. Sarah, welcome to the Health and Wellness Podcast.
Well, thank you so much. I'm really excited to be here and to share my journey with your listeners.
Well, thank you. And I think it's going to be a very inspiring journey from retiring through the day you retired and into retirement. And so if we can, we'll start with your career. We'll talk a bit about, your practice and your time in medicine, and then what you did to prepare as you were approaching your retirement date. One of your messages here is that there's a lot of work to be done before you get there. So let's take a step back and we'll start just with your career in medicine and how you started preparing for your retirement journey.
Great. So I practiced cardiology for nearly 30 years. And as a cardiologist, I worked mainly in private practice. I was on faculty for a year and then transitioned to private practice. I was with one group for 6 or 7 years, and then my second group was the group I stayed with through the end of my professional career as a cardiologist. So I grew up as the daughter of two physicians, and I saw the way retirement played out in their lives. And that was not the way I wanted my retirement to look. So my father unfortunately had a stroke in his early 60s. I think he was younger than me when he had the stroke. He was a very successful academic endocrinologist, but didn't take care of his own health, and the stroke was absolutely devastating. And yet it was desperately difficult for him to give up his identity as a physician. There was no way after the stroke that he could go back to work, but that was who he was. And so it was a very painful, a very immediate transition for him. My mother was a family practice physician and loved her work, really got much of her identity from being of service to people. But again, when she chose to retire in her mid to late 60s, she just had a lot of difficulty letting go of that aspect of her identity. I think being a physician is an important part of our identity. I still feel that that's part of my identity, but she had not fostered other aspects of her life. And so when it was time to leave practice, it was very difficult for her to feel as if she was part of a community and as if she was a contributing individual. So I saw that, and that I think had an impression on me, even if I didn't, outwardly verbalize that. But what I realized early in my professional life was that in order to create a sustainable life going forward, I would need to have my finances in order. So I started early in my 30s preparing, even though retirement just seemed like a very abstract idea. But in my 30s, I started preparing with a financial advisor and just slowly putting money away. And that was a real foundation for me to be able to make a decision that I could live with decades into the future.
Absolutely. And I guess what I'm hearing is you had a very unique perspective into this retirement transition, not witnessing one, but two stories of the transition into retirement, and maybe those obstacles and challenges. You mentioned the identity piece for physicians who spend uh, up to 50 years. I mean, several physicians decide in their teens that they'd like to become a doctor. And there's a lot of framework there that's provided in identity, right? There's the education piece, there's the residency, potential fellowships, and even as an attending, the arc of your career is really laid out for you from the moment you decide to go into practice. And what's not is this retirement piece, that blank slate. And so you got to witness two very, it sounds like, impactful storylines in your parents, and you said, I'm going to make a decision very early in my career to be intentional about this process. Is that fair?
That's absolutely right. And, there were things that I really enjoyed outside of medicine. So I loved caring for my patients. Being a cardiologist was an exciting professional life. There were, over the time that I practiced, so many changes in cardiology that gave us so many more opportunities to help people. So I loved being part of that. But there were also things that meant a lot to me that I needed for myself to pursue. So, for example, I have horses, so I had to create the time for that, and the room within my life for that. If I ever wanted to pursue horses, that wasn't something I could put off into the future. Those are skills you have to develop early, or it's best to develop early, and I think it would be very difficult to start now. But also, I've always been involved in the arts and the humanities, and so even though I was not actively involved as an artist, I maintained those connections. Even though they were kind of tenuous, I maintained a connection throughout my professional life.
Well, let's talk a little bit about that because in the health and wellness model, one of the concepts that we talk about a lot isn't just the identity piece, but the psychological and social losses that are associated with retiring. And it sounds like you maintained some thinner lines throughout your time in practice so that those lines existed and we could draw back over them with a thick, wide Sharpie and say, hey, I'm going to maintain these looser threads while I can, when I have to, so that when it's time to rekindle this, there's a little bit of an ember there. We're not starting from scratch, from ground zero with a tinder pile. We've got some fire burning there. How did that help with your transition?
Yeah, that's such a great way to describe it because I think that if I were to have transitioned with just these kind of abstract concepts, it would have been very hard to figure out where I wanted to go or how to move this forward. But so I'll start with the horses. That was something that I fostered and devoted a lot of time actually to. I took a half day off every week, even though that did cost me financially, because that was a passion, still, that's a passion of mine. It also gave me another community of friends that were
Hmm.
not medical, that I didn't have to be the expert with. It's great not to be an expert, to be able to have a beginner's mind, to be able to have someone else, who knew more, work with me, and so I really enjoyed having that aspect of life where I wasn't expected to know everything. So I think that was really sustaining for me for so many reasons. It opened up a lot of other doors, which I can talk about, including yoga and mindfulness, things that I might not have expected when I got involved with horses. But that was a real through line, which branched out into other through lines. The connection with the arts was definitely more tenuous, but I maintained an active membership in my local museum, went to galleries, just kind of stayed in touch in this way with the art world. I'm a photographer. I had very little time to devote to that craft, but I just kept learning a little bit and a little bit more. And so when it was time for me to start thinking about retirement, I knew that, this passion for the arts and the way that the arts and humanities connects to our ability to see the world through other people's eyes, that really excited me. And I didn't really know where I was going to go with it, but I just had this kind of drive to pursue that. And as a cardiologist, as a physician, I think a lot of people can relate to this. I value expertise. So I didn't want to just jump into it, and just kind of flail around. I decided I wanted to get a master's degree. Well, I didn't really have a portfolio or anything like that to show for myself. So I realized I needed to get a bachelor's degree in fine arts, or at least I felt like I did. I needed, um, level of knowledge. And so I actually just graduated last year with a bachelor's of fine arts degree. So I planned all that though before I retired. Like, how would that look? How would I make that happen? From getting my old college transcripts, allowing, hours to transfer to, what type of opportunities would I have where I live to do this? And then that opened up all kinds of opportunities. I'm happy to talk about that because I have made so many connections which connect this interest in the arts and passion for the arts back to healthcare and connection with people. And I've become involved at the local medical school with a course that connects the arts and humanities to healthcare. So it's opened up so many doors. And I'm just really grateful to my younger self for making these opportunities.
Absolutely. And I love that you said, you took these half days off to keep putting a little bit of tinder on that fire that really had to exist off to the side. But you made a conscious and informed choice that although there was a financial sacrifice, you're now thanking your past self because you kept some of these interests outside of your practice in medicine. And it really has served you well now in this transition. I'm curious, I might know the answer to this because we've obviously had some conversation ahead of time, but what role has coaching had in your career trajectory? What role has financial planning had to give you some of that freedom to say, nope, I'm going to be okay. And I actually should do these things, not just that I want to, but it's actually going to be to my benefit, even though it feels counterintuitive.
Yes. Well, thank you for mentioning coaching, because that was a really important part of this process. So I decided around 2019 that I was really at a point that I wanted to pursue retirement. That my professional life was still something that gave me meaning, but I was ready to move on. And I didn't feel like I could talk to anybody about this, besides my family, because nobody else really would understand. I didn't want to kind of create waves in my practice. It wasn't something that people did, and I didn't want to, um, have people talking about it or kind of second guessing me. So that's when I realized that I really needed to work with a coach. I kind of did a lot of exploring on the internet, like a lot of people probably do, and that was what kept coming up was finding a coach. So I was really fortunate. I found a wonderful coach. I worked with him for actually a couple of years because I spread my sessions out. Ideally, we're taught as coaches every few weeks you should meet, but my situation kind of lent itself to maybe a longer arc. And then the pandemic hit, so that it kind of complicated things. But on the other hand, it didn't. I, had no reason to retire before getting through the pandemic. So I worked through the pandemic and retired in 2022. But working with the coach really gave me a space to kind of think and strategize and kind of feel like the things that I was talking about and thinking about were not crazy, and that there was a way to kind of untangle this knot that I had gotten myself into. And then as a result of that, it was such a powerful process. I became a coach in later 2022 after going through the Physician Coaching Institute program. I went through a different coaching program before that. I'm happy to talk about that as well. But I think the PCI program was what really gave me the insight that I needed and the skills and time and support that I needed to become a coach myself.
Well, I'd love to talk a little bit more and dive a little bit deeper into that. So, specifically, the PCI that you mentioned is the Physician Coaching Institute, and you and I both share the credentials of Master Certified Physician Development Coach. Obviously, you as a physician and me as a financial planner. And as we look kind of one step beyond that, you mentioned, and I think everyone in healthcare probably has a long list of things they are excited to retire from. It's the being on call, the stressors of the faster pace, the louder drumbeat, and the increasing rate at which healthcare is being asked to be provided. And so when you get into your late 50s and early 60s, it seems to stir this bit of, okay, I've got to revisit my finances and I know what I'm retiring from. But you mentioned kind of untangling and maybe unearthing and mining out some of these pieces of your life that have been there for a while to create this plan to have to retire to. And so, through the pandemic, you've got this massive dependency on adaptability. I mean, things are literally changing daily. And in the meantime, you're navigating your retirement transition. So if Sarah can do it, you can do it. And so, you've got your things you're retiring from, but how did that coaching develop your plans for what you were retiring to?
Yeah, so we talked about the things that really, light me up. And, sometimes those things seemed like impractical or, there was no way to kind of make that all fit together. I was at a point where financially I was going to be okay, but so it wasn't about how am I going to make a living. It was about how am I going to make a life, and
Mhm.
what is my life going to look like? And, we kind of talked through a lot of the things that kind of, like I say, seemed impractical. So, for example, I got into yoga after I broke my arm on my horse in 1997. But it changed my life in a lot of ways. Kind of finding that mind-body connection, finding the ability to develop calm within the storm. That really related a lot to my life as a cardiologist, as well as to my life as an equestrian with my horses and just life in general. So that came up, and I had an opportunity to pursue a yoga teaching credential. And just, talking through this with the coach, I found a way to make that practical, and I found
Yeah.
opportunity that I could work with my schedule. There was a school in the UK that was doing virtual yoga teacher training, and I had that opportunity for my schedule to align. And so developing that then developed more skills, which also led to an opportunity to train as a mindfulness coach, which then led to kind of the realization I needed more if I was going to work with physicians. But again, all of these kind of ideas, these little strings and threads and the arts and how all of this would fit together. It was a safe space to kind of reflect and to kind of process and to kind of take these ideas further, but not just to talk. I mean, the beauty of coaching is, it gives you um, another person who is um, asking you with curiosity to describe and to explain and to think more deeply, to follow these little, breadcrumbs and just see where they go without any obligation. So it was such a powerful experience.
Well, you mentioned the power of coaching and that we can explore some of these ideas that you mentioned being tangled. I'm imagining the breadcrumbs that might feel like they lead to a dead end or things that we self-impose as a restriction to say, time doesn't allow for us to develop this right now. And all of a sudden you get into a coaching setting and you're given permission to develop what felt like a dead end or a back eddy to some degree to get you back out into the flow. It's no longer just a finger that ends up in a bit of backwater, so to speak. We pull those ideas back into the current because I love the language that you used. You're no longer focused on working as a medical professional to earn a living. Now you're creating a life. And in retirement, that's exactly what you have to do is take over and reclaim that agency. And from my experience interviewing other retiring and retired physicians, really rediscovering your sense of self. And coaching provides that environment to say, no, you are empowered. You can do this work. And you have permission to explore and articulate some of these things that ultimately leads to not just talking about it, but action. And so you started creating this plan as a result of coaching to find things that work into your schedule. And all of a sudden you've created the framework of a life in retirement that's been phenomenally rewarding. But that's not by accident. And so could you share just with listeners, someone who's maybe on the fence about exploring coaching or unearthing some of these maybe things that they've put away for 20 or 30 years that they're passionate about but had to forego for their own career? What advice or what information would you give them as they're thinking about their own retirement?
Yeah, so there's a couple of things that I think are really great mantras to live by, and one is that action creates clarity. So when you take action, you might start going in one direction, and then it might become clear that this other direction is calling to you. But if you don't actually take the action, if you just stay still, nothing's going to happen. So just taking small steps that are reaching towards perhaps a broader goal. You don't have to define that goal clearly, but just have some kind of plan and then understand that that plan can change at any time and you don't owe anybody that responsibility. It's yours. That's important. And then the other thing that I like to keep in mind as a visual artist, as an artist, and I think this is something that can apply to any kind of endeavor, is this is something Picasso said, that the muse finds you working. So
Mhm.
you're not going to get inspiration again if you're just sitting, looking at your screen. If you're working, that's how you find inspiration. So whatever that work might be, going out with your camera, going for a run, talking with other people, but being outside of your own head, that's where the muse shows up.
What's so interesting as you're describing that, I'm picturing a little bit of, mining or a river flowing, but following the veins that allow for us to continue. It almost feeds us as we're flowing into these. And then you mentioned the working finds your muse. It becomes a practice or an expression of self rather than a labor. It becomes that vocation. But to know which direction to head, to take those actions, sometimes we need a little bit of help.
Yeah, absolutely. And that's really where the coach comes in because a coach can reflect your ideas back to you. And often when a coach paraphrases something, it suddenly becomes clear. So that is one of the skills of coaching, and it sounds like it might not be difficult, but it actually is a very intentional skill that takes a lot of training and a lot of focus to be able to reflect somebody's thoughts and ideas back to them in a way that kind of opens up more possibilities. So for me, that was incredibly powerful as I kind of started to plan my journey out of medicine.
Excellent. And I think how deep of a contrast that must be between the roles and expectations in medicine today, and how it is very little about the agency of the physician and very much more what the roles and expectations are for the greater good of the healthcare system or the patient. And so I see you're excited to jump right in on that. So I'll stop there. Feel free to just jam off that prompt.
Yes. Well, I think that is one of the huge changes that has taken place in healthcare. And people that are just starting out may not have experienced this type of shift, but for those of us who have been in practice for more than a decade or two, the healthcare system has changed so dramatically. When I was in medical school, there was hardly even an idea of an HMO. Like nobody really knew
Mm.
what that was, much less somebody else telling you how to practice. So, we had paper charts. There was definitely negatives to that, but the chart was really a way to communicate. It wasn't for billing necessarily. It was a way to provide the best care and for continuity. And over time, then, and I'll also say that all of us in my medical school class, when we graduated, we expected to be our own bosses. Like nobody was going to tell us what to do, other than the importance of working with, the highest quality in mind and doing the best for your patient. But nobody was going to be in charge of us. So now it's a little different, or very different, and that was a real shift that for me was difficult, and that also kind of helped me to feel comfortable about leaving, because that wasn't really a way of practicing that was in alignment with the way that I saw my medical practice evolving.
Well, with that, Sarah, I think, we've done a phenomenal job teasing out kind of some of the core storylines of your career and what's led you up to exploring coaching both as a client and now as a certified physician development coach. I think it's a real good time if we can just, we'll put a quick recap on kind of the highlights of our conversation. We'll wrap up this episode and then we'll get ready to talk more in depth about some of your endeavors here in retirement. And so, after you've had this unique experience yourself and watching your parents go through this transition, it really allowed you and almost gave you the sense of permission to really preserve that sense of identity outside of physicianhood for your entire career. And now you've done a phenomenal job preparing for that transition into retirement. Anything you'd like to add to that as far as your passions or goals outside of career that listeners would find beneficial?
Yes, I think it's really important early on in your career to give yourself the opportunity to explore at least one thing that lights you up outside of medicine. Find something that doesn't require too much of you, but allows you to explore something that's interesting or intriguing, no matter whether it connects directly to healthcare or not. And then the second thing is, as early as you can, just start putting away a little bit of money. Make that a priority. Even if it's a small amount, it will accrue over time, and your future self will thank you.
Awesome. So I'm hearing making deposits both on the personal and financial side of that retirement journey that can start very early in your career.
Absolutely. That's a great way to put it.
Excellent. Well, thank you, Sarah. Again, Dr. Sarah Samaan. This will be a first of two conversations. And so we'll see you in the next episode as we really dive into what's making your retirement so phenomenally enjoyable for you.
Well, thank you so much. I really enjoyed it.
Absolutely. Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Schwartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.